Hi everybody, welcome to Mondays with Mark. Today we're going to talk about a problem that a lot of runners experience, and the common name is a bunion. What is a bunion? The medical term for bunion is called Hallux valgus. And what is a valgus? A valgus just means that the toe is deviating towards the lateral side. So you can get a valgus in the knee and you can get a valgus in the foot. But in the big toe, what it basically means is that the distal phalanx deviates away from the first ray of the big toe. What that causes is that there's compression on the inside of the big toe and stretching on the lateral aspect of the joint capsule. So you get a tremendous amount of pain in the joint capsule, and it leads to a capsulitis, which is similar to, if you guys know what a frozen shoulder is, you kind of get the same thing in your big toe. A hallux valgus comes due to two main reasons. One is genetic, and of course we know that there's not a whole lot you can do with genetics. Whether you support your foot or whatever, if you have it in your genes, you're going to get a deviation of your toe. The second reason, and more common, is mechanical. So if you have a forefoot varus and you pronate in late stage, when you load the toe and you come into toe off, if you don't have enough extension in your big toe, you have to deviate medially to get around it because you can't come up and over. So if you can't come up and over, you have to go around it, and that's what makes the toe deviate to the inside. And so in order to control structural hallux valgus, you either have to have a forefoot varus correction, a Morton's extension, or a first ray cutout to increase the range of motion at the big toe. Again, one of the more common problems, if it's genetic, there's not a whole lot you can do about it, but you can make sure that you maintain the range of motion, wear good shoes, keep the mobility in the joint. If it's structural, you can get a Morton's extension, a forefoot varus correction, or a first ray cutout, depending on your foot type. So if you don't know your foot type, come into the store or your local running store that knows the mechanics of your foot, and they can tell you which type of foot you have and what correction you need to get. Thanks for tuning in. See you next week.